My first guest is Marilyn Kraner, and Marilyn is in charge of Jewish Care Services for individuals and families, support services. Welcome to Talking to the Max, Marilyn.
Thanks, Gary. It's lovely to be here.
It's terrific to have you. So, individual and family support services. What does that mean?
Yes, it's kind of a really odd name.
It's a big bag, isn't it?
It is indeed. We're all sort of either individuals or families somewhere along the way. Relationships are important. I guess Jewish Care is really quite well known for its services to the aged community, both its residential services and its community services, as well as its disability services. But we actually have a whole range of other programs that are very much geared towards the younger cohort, the under 60 cohort, and even younger than that we're seeing it comes up. But the services that I'm talking about are not just our counselling services, which I think most people do know about and are utilised, but we also have financial counselling services, we have interest-free loans for the community, we have mental health promotion work, and we have housing that's available to people, and we have a whole team of social workers that work with complex matters where people have multiple needs that can't just be met with one program area.
Can you give me an example?
Yeah, I think, Gary, gone are the days where we're trying to fit people into a program.
Right.
We often get calls, and increasingly we're seeing people call because they have a range of issues, often triggered by some really mainstream life event like a loss of a job, which spirals into economic hardship, which then spirals further into the inability to sustain their rent or maintain their mortgage. That then has psychological impacts.
Not coping.
Some people have underlying mental health issues or engage in drug and alcohol. People, it is almost rare these days, unfortunately, for people to call us early. They come at a time when a whole lot of things have spiralled.
So they've met a crisis.
Absolutely, and they see what they experience is a range of multiple needs that one single program on its own doesn't feel sufficient. So we try and wrap around services.
There's a package.
Absolutely, and I think it's really important. So whilst we talk about the programs, and I've mentioned some of them now, really they're not standalone programs. Most of these programs work closely together because we understand that if you have a housing issue, you often have a financial issue. Yeah. If you have mental health needs, then there are other things in your life, including unemployment and the need to get social supports that need to be looked after as well. So it's a whole of person, whole of family approach, which I love.
How big is the team that has to provide that great big package of
services?
Well,
we're very fortunate, and I think in many ways we have a team that changes based on needs. But right now there's a team of around 20 people that work. Some are social workers, some are finance people. There are certainly dedicated counsellors that are, many of them, both of them family therapists. We also have a tenancy and property manager that has a huge amount of experience in supporting people to find housing that's sustainable, because that's a big issue, not just for the Jewish community but for the community as a whole. So it's a range of people with a range of professions and a very strong social work team to kind of coordinate all of that.
Okay, and I guess we're touching on a range of issues that we in our little cocoons, thinking, we're a nice middle-class group of people, don't often actually recognise or believe that affect the Jewish community. So, I'm talking about things like, over the last 2 years, since the Rosie Batty incident, the incident of her son's murder, we've seen a focus on family violence.
Absolutely.
Is that part of what you see? We've also seen a focus on homelessness. Are those things that touch our community as well?
Look, Gary, it's so surprising how no different we are to the rest of the community. Yeah. I'm part of the Jewish community. I grew up in a kind of traditional family, and I made assumptions as well about what happens in the community. We're very family oriented, so there's a strong assumption that kids are safe, that women are safe, but the reality is that these things in family violence, child abuse, unfortunately, all occur within our community. They're often even more hidden, which makes it much more difficult for us.
Yes.
But Jewish Care is a child first provider, and what that means is we are funded by government to specifically work with families that are vulnerable or at risk of either their children experiencing abuse and neglect, or for significant discord to occur that puts women and children at risk. So we're actually trained, accredited provider of that service. And I have to say, Gary, unfortunately, over the last 2 years, the demand for that type of response, that wraparound response for vulnerable families because of both family violence, but often family violence that then lends itself to, housing issues and homelessness, is increasing. And I think Jewish Care, as the primary service provider for the community, is seeing it, double or triple, but I'm sure other support services or other agencies would also certainly talk about that as well.
Yeah, I mean, how do we know where to go? If we're in need, how do we know who to contact? What do we do about it? Often the first thought in mind is probably, I don't know, is it police? Is it the bank? Is it a trusted friend? So how do we actually find out about Jewish Care providing this great big range of services?
Yeah. Well, Jewish Care's been out there talking a lot about things. I mean, we work very closely with the Jewish Task Force Against Family Violence. We work closely with Tzedek as well. So as a team of people, we try and make sure that we have a shared message that's really clear about the importance of safety and the importance of our children in our families. Our website certainly talks a lot about the services we provide. And most interestingly, we've been running parenting forums for the last 2 years now. Each forum sees, close to around 80 people come, and often different groups of people each time, and they're focused on what's really important to the Jewish community, which is parenting our children, and has had a very strong mental health and child protection flavour. So the community is interested. The community wants to know. Our philosophy is talk to anyone to start with. Just talk. So if you feel your trusted person is one of the agencies, including Jewish Care, then ring and talk. There is absolutely no obligation post a conversation, and the information will be shared. Where we believe that children or families at significant risk, that's the conversation we'll be having. Is what are the next steps? Is it the police? Is it child protection? Are there things that can be done before any of that happen? But it's really important that we stop sitting behind a screen of silence, and we start to talk about these issues to people who are prepared to listen. And I like to say that if you feel like you're not being listened to, go to somebody else. Do not stop at a person that says either I don't believe you, or there's nothing that can be done, or you should just sort that out, or the community will sort it out itself. Because the reality is that's where strife happens, and we know that from things like the recent child protection, the Royal Commission, and we know that from our family violence feedback that we get, that keeping it quiet and silent is just not good for anyone.
So if you need help, make sure that you do something about it, that you're positive and act to get help.
Absolutely. And people can know that they can ring anonymously. There's no major requirement at the start to disclose who you are and where you live and any of that. People need time to slowly divulge things, because it's scary to do that at times. Family violence in particular, you need to feel safe to disclose your lack of safety. And I think, we all acknowledge and understand that, and we're prepared to listen.
I think that's a really important issue. People need to know that they have a safe place to go to disclose these things, which they don't want to disclose. I mean, the natural reaction to things like this is, let's not disclose it. Let's keep it quiet.
Absolutely, and there's so much shame and guilt around it. There's a lot of high expectations about how you will be in a marriage. When relationships start to break down, and again, the Jewish community is no different. We see a lot of relationship breakdown. It still fills us, absolutely, but it fills people with a lot of shame and guilt. So to start to talk about that, to start to say it's okay, that it's not any one particular person's fault, but in that there are supports around and a whole lot of people and services that can assist, is really important for people to know.
Absolutely. And is there a relationship with the schools? Because I know schools teachers have a requirement to report issues when they see danger for a child. So is there a link with the schools as well? Because I know that's an official government train of communication, but is there also a relationship with Jewish Care?
There is absolutely a relationship with schools, and I think teachers have got it really hard these days.
Do.
I think
They
there's
do.
a whole lot that they're expected to do, and it's no longer just about, literacy and reading and writing, and none of that. There is much more, and there's a social responsibility that they have, and that's a lot for teachers to carry. So what Jewish Care does is makes itself available as a consultant to teachers. So we have schools ranging from the extremely orthodox to the far less, more secular Jewish schools ring us when they're concerned about an issue to get ideas and thoughts about what to do, to understand the service system, to understand child protection. There is a lot of complexity in this.
Yes, it's
and
very confusing. It's a web.
Absolutely,
Yeah.
and very difficult to sometimes differentiate what's an observation that really has some basis to it, how much more do you need to do. Although it's not teachers' responsibility to investigate, it is their responsibility to report.
That's right.
And so Jewish Care spends a lot of time, and will continue to do so, talking to schools formally and then informally consulting with teachers about what might be going on to help them kind of work through the web of what they're seeing and what they're understanding to know how best to support children and families, because everyone wants to do that.
That's right.
It's not that no one wants to do it. We all want to do it. We're just not always sure how to.
We're not sure how to.
And that's really what particularly our service coordination or our social work team is there for. And we do that regularly and encourage people to certainly call in.
So do you also try and train people about their responsibilities within Jewish organisations, be it a school, a shul, a scouting group or whatever? Do you have the ability, the arms and legs to be able to actually sell your message to them, people who can identify issues?
Yeah, we certainly we do that, but not on our own. We certainly do that with Task Force and with SEDEC, because I think, like I said before, a united position is really important. But we actually do go out and we have spoken to shuls. We do go to schools. We have a whole lot of forums that we run. In fact, we've got a forum hopefully coming up in September. We're just locking in our speaker that is specific to identifying the difference between what child protection does, what police do, what Child First does, and how to differentiate that. But it's ongoing work, and it's not really just the responsibility of one organisation. We need the community as a whole to make it okay to talk about this, to make it okay to say, I'm wondering about my neighbour, I'm a little bit concerned, I'm hearing things, what should I do? And for people close to say, why don't you ring Jewish Care and just ask them, just have a chat and see whether this is something that we should be worrying about or maybe not. If particularly if you see someone close, not just, children, it's sometimes difficult to kind of differentiate, but, women who physically are changing, where people who are confident suddenly become withdrawn, friends that you used to see that suddenly you're not seeing because of a new relationship and things have changed, they're the ones that you need to reach out to, and those are the situations that we really would encourage people to come and have a chat. And again, like I said, Jewish Care is there. We're a large service provider, and we can certainly wrap around a whole lot of programs. But it doesn't have to be Jewish Care. It can be,
of course,
a whole range of other providers. It's about feeling confident about what that the person you're talking to can provide you with the information that you need.
That's right, and I guess often, although being a Jewish organisation, you're providing the cultural understanding of people that mightn't necessarily be there with a service provided by non-Jewish people. But on the other hand, some people might say, well, I don't want to keep it within the Jewish community. If I seek help, I want to go elsewhere. So there's that dichotomy, I guess, too.
And we're really aware of that. And I think one of the things, which is why we've always said is, it would be terrible if we didn't create really good links with the mainstream service providers, the secular service providers, because people need a choice. So we also don't have an issue if people call us, we talk about the issues, we talk about what supports might be available, but if they then say, actually, I don't want someone from Jewish Care, I don't want to do it in the Jewish community because I'm still trying to keep it a bit quiet, we have excellent links now
Right.
and networks with a whole range of service providers, both specialist ones like the legal fraternity, but also just generic community health centres, the Anglicares and Family Life, others in our community that we work with regularly. We consult with them about, Jewish cultural needs and religious needs, so they have a good dynamic with us, and they also refer to us and we refer to them. So that's kind of a luxury.
So those links are there. That's
absolutely.
good. Yeah.
And it is very much about choice because we can't force people, as much as we can't force them into programs and make them fit into our boxes.
Absolutely not.
We can't force them just to come to our service.
People can't take help, can't accept help unless they're willing to accept it.
That is.
Which is difficult. In this day and age, and at this particular time, I'm looking outside the window and it's freezing cold and all of that sort of thing. What are some of the biggest issues that are apparent to you? I mean, and I say it's cold outside because I think of homelessness as one issue. That may or may not be one of the biggest issues. What are some of the biggest crises that you see today facing the community?
Yeah, certainly family violence is one of the biggest ones. Family separation and the whole discord and its impact on children can't be underestimated. I think housing strain, homelessness and can mean different things to different people. What we do know is economically people are struggling, and often that's the first disclosure that they provide when people call us, is that they're struggling a bit financially, and we find that there are months of non-rental payments and months of utility bills building up. I think that's a very big issue, and our financial counsellors are excellent at helping people sort through dealing with debt collectors, sort through trying to understand how to manage a budget, their waiver fees. They do a whole lot of work. So I think economic strain and therefore housing stress is a really big one for our community, and we know that there's a lack of affordable housing.
Yes, Melbourne's a very expensive place to live in. Yeah.
But for the Jewish community even more so, because if you lead an Orthodox life and you want to be near your community hub and you want to be near your shul and the Jewish schools,
it's even more expensive.
Yeah,
that's right.
You can't choose to go out to Cranbourne and live out there because it's impractical and you can't live the life you want. So, we are in many ways restrained by the parameters of where our community has set itself up.
Yes.
And therefore, we do a lot of advocacy, I have to say, with government about those issues, about housing affordability, to make sure that people are able to stay in the community but in a sustainable way.
So when you say you do a lot of advocacy with governments, are they providing support as well?
They don't provide financial support.
Right.
And our housing program we have around over 70 properties ourselves that we provide to the community at a very low rate, around close to a public housing rate, so people can afford to live in there. But I guess...
But that's subsidised from within the community.
That's subsidised from within the community.
Right.
However, increasingly, we're working with government to at least... try and get some of larger properties where we can, so that those from the Orthodox community in particular who have larger families aren't being forced out into further into suburbs or trying to sustain a lifestyle that they can't actually afford.
Yeah.
But really it's the community and the donations that we get that are making the fundamental difference. And I can't, although we get some government funding for the Child First program, the rest of all the programs I've talked to you about are all funded by the community.
Wow.
And we're so grateful for that, but it's so required. Otherwise we couldn't provide the things we did.
And that community appeal is ongoing at the moment, or has just ended?
Yeah, I think it's just finished,
Yep.
but I wouldn't hesitate to suggest that the development team would be more than happy to receive donations outside of the annual appeal. But
I'm sure that's right.
Yeah, I think that's one side, and we're always grateful to the community. But more important to me is for the community to know that we are there for them, and that we will continue to listen and hear what the issues are and adjust our responses to make sure that the needs of the community are met.
Yep.
And that's a really important thing for me as the manager.
Absolutely. And Marilyn, just a little bit about your background.
Okay, this bit I didn't expect to say.
Well, we want to get to know you.
That's fine. So I'm a social worker and a family therapist by trade, and I have spent a lot of time working in child protection. I worked at South East CASA, a centre against sexual assault, for a long time. I worked in child and adolescent mental health for a long time, and then I became one of those long-standing bureaucrats and did a lot of work in what was called both the mental health branch but also multiple and complex needs, which is in fact a statewide initiative that is dealing with complex issues not so different to what we've now established in Jewish Care. So I used some of that experience and that background to kind of help form some of the social work offerings we have now. But I'm also a parent of 2 children, one 19, Ruby, and a 14-year-old son, Oscar.
Ah, very nice indeed. Now, You've described the range of services that you have available. Now, if I want to avail myself of those services, what's the best thing I can do?
Jewish Care has got a fantastic entry point. Our front door is a single entry point for all services and information for the community, and that number is 8517
8517
5999
5999 8517 5999. And of course a www, there has to be a www.
Absolutely, www.jewishcare.org.au.
Right. Well, Marilyn, thank you very much for outlining those really important community services. Your team does a tremendous job, I know, and there's probably not enough time in the day for most people to address those issues. Sadly, we have a lot of need out there, but it's nice to know that it's being addressed. So thank you for talking to the Max today.
Can't agree with you more. Extraordinarily professional team that I have, and thank you very much for your time.
Yeah, it's terrific. Thank you.